with you this afternoon. I hope it's lovely and sunny up with you in Scotland. I'm here in North Yorkshire, so a little bit further south from you. So as Kirsty said, I'm the RCGP Clinical Policy Representative for Safeguarding. I'm a GP based in Harrogate in North Yorkshire. You'll be able to tell from my accent, though, that I grew up in Northern Ireland. So I've been with the college since 2017 in a safeguarding capacity and lead on all the safeguarding work within the college. And one of our kind of big pieces of work over the past couple of years has been developing the new safeguarding standards for general practice and the toolkit to go along with that, which is what I'm here to talk to you about today and just go through that. And then I'm absolutely delighted to be joined by three members from Adult and Child Protection in Scottish Government. So who are also going to share some information with you a little bit later on. So I'll let them introduce themselves first of all, so you know who they are. So Teresa, can I come to you first of all?
Hi everyone, thanks for coming along today. I'm Teresa. I'm from Scottish Government's Child Protection Unit, and safeguarding and health is one of the areas I look after. Nice to see you.
Jamie?
Good afternoon, folks. My name is Jamie Aarons. I'm a professional social work advisor embedded in the Adult Support and Protection Policy team at Scottish Government.
And Gemma?
Hi folks, Gemma Graham, Scottish Government Adult Support and Protection Policy Manager. Nice to see you.
Lovely. So Jamie, Teresa and Gemma will be sharing some stuff with you later on. So let me just, as we go through, we will take questions right at the end. So after I've spoken, after Teresa, Jamie and Gemma have spoken as well. So if you've any questions you think about, please put those in the chat as you go along, and we will try and answer those a bit later. So we'll not respond to any questions sort of through the presentation, but we'll do that at the end. So let me just hopefully get to the right place. Yep, can we all see that?
Yeah, that looks
perfect.
Good.
Wonderful, thank you. Okay, so safeguarding standards. Why are safeguarding standards needed? So safeguarding standards for healthcare have actually been around for a long time, particularly children's safeguarding and child protection standards. You may or may not be aware of, they were called the intercollegiate documents. They were, the children's one is now in its kind of fifth iteration, adult one in its second iteration, and they set out from the Royal Colleges of all professionals, obviously set professional standards. So the intercollegiate documents were the Royal Colleges all coming together to set out the professional standards for safeguarding, so that children and young people and adults, no matter who they saw in healthcare, in which UK country, or whether you were in a city or a village or wherever it was, that you could expect the same level of safeguarding. Because we know safeguarding is complex, and we know that it, certainly, when I was at medical school, it wasn't ever, I don't think the word was even mentioned. So we know that's something that people don't necessarily have a lot of backgrounds in. And the bottom line about safeguarding standards is about children and young people and adults who are at risk of harm, and ensuring that no matter where they see healthcare, that they know that their safeguarding needs will be met. They know that staff are trained to identify abuse and neglect and know how to respond to it appropriately, and work with other agencies, because we know safeguarding is obviously a multi-agency task. It's no one single agency or no one single profession can do it together. But we know there's lots of challenges. And so the intercollegiate documents have been around for a long time. And from a college perspective, the last time they were done, which we were involved in that back in probably 2018, 2019, in the revisions of them then, we already started to get a lot of feedback from college members and from general practice about whether they were the most appropriate for general practice. There was a lot of concern about the hours-based learning. So you used to have a certain number of hours safeguarding training every 3 years, etc. So we made a decision, and then a decision went through RCGP Council, that the next time they were revised, we would develop our own safeguarding standards for all of general practice, applicable across all the 4 UK nations. And in doing so, we've been able to, for me, it's been a really exciting project, working with lots of different people across the 4 nations and within safeguarding and out of safeguarding. trying to think about what does good safeguarding look like in general practice in the current climate. The current landscape, it is the same for all of us across all 4 UK nations in terms of general practice in crisis, not enough resource, lots of things that we would love to be able to do as GPs and love to have the time to do, but we don't, and it can be really tricky, can't it? So it was trying to develop standards that give us really high quality safeguarding within general practice, but that it is relevant to the role of general practice. So just in case you're in any doubt about the importance of safeguarding, the GMC, as you probably know, updated their good medical practice last year, and are very clear about doctors need to be competent in safeguarding children and adults who are at risk of harm, and this is what it says in good medical practice, if you need that reference. So this is our RCGP safeguarding standards. That's the QR code, that's the link. If you just go to RCGP Safeguarding Hub, I've got a link for that a bit later on, that will take you to our new Safeguarding Hub where everything is and where you'll find everything. So we launched these at the RCGP annual conference in Liverpool last October. And what we've done with these safeguarding standards is develop a whole life course standard, because as we know in general practice, we look after everybody from unborn to death, don't we? So everybody we look after, so it doesn't make sense to have a separate child and adult safeguarding standards. There are obviously differences in both, and there are some very specific child things that we need to know, and there's very specific adult things that we need to know, and legislation is different for both of them, but a lot of the things are the same, particularly when it comes to documentation. There are lots of safeguarding issues that affect both equally. Domestic abuse is the classic example of that, isn't it? Which can, affect everybody across the whole life course. What we have developed are adult and child safeguarding knowledge and capabilities, and what we've said is that they are equally necessary and expected for all staff in general practice, even if that staff member only works with adults, because if you only work with adults, you still have to understand the impact of adult related things on children to be able to safeguard the children who might be in their life. So it includes levels 1 to 3. So you may be familiar with levels 1 to 3. That's where safeguarding training has been from the intercollegiate documents for a long time. There are 5 levels. Level 4 and 5 are for safeguarding professionals. So one of my other roles is a named GP for safeguarding in primary care across North Yorkshire and York. So I sit at level 4 for that, for example, where we strategically support general practice with their safeguarding. It includes all staff working across general practice across the 4 UK nations in any setting. So that includes NHS, independent practice, online providers, and PCNs, which are in England, and GP out of hours, extended access services, and there will be other as well. And the standards and the training requirements replace completely the previous safeguarding training requirements. Apart from, so GP trainees, if there's any GP trainees on the call or GP trainers on the call, your requirements for the MRCGP have not changed. They are still the same. And actually the new standards and training requirements for qualified GPs and general practice staff are actually now much more aligned to what you as a GP trainee have to do for your MRCGP. So they're the same. So in terms of the go-to document for safeguarding standards for general practice, it's the RCGP document. So when we were developing these standards, these were the aims that we wanted to kind of bring out throughout the standards. Was one, first and foremost, it has to be focused on the needs and the voice of victims and survivors of abuse. If it doesn't actually make a difference to them, then there's no point in this. What we do actually has to make a difference to victims and survivors of abuse. We wanted to focus on the specific skills, knowledge and expertise that GPs have and general practice have as well, and relevant to the resources and context of general practice. We often hear the phrase safeguarding is everybody's business, and that is absolutely true, but sometimes then within that it all gets a bit lost about who's doing what and whose responsibility is it to do this or that. So what we wanted to try and do is make it really clear what our responsibility is in safeguarding in general practice, because we are a key partner agency in that, and it has to, we provide universal healthcare to essentially the whole population, so our safeguarding standards have to be relevant to that. We also have to want to be really mindful of the well-being and welfare of GPs and general practice staff who are already under huge amounts of pressure, and we know that being involved in safeguarding cases in itself can be really, really difficult, and particularly if you yourself are a victim or survivor of abuse yourself, that can add to the challenge. And we wanted to make sure that we were taking into account those pressures, but also recognising that, you know, we are of course not the only profession that faces pressure. We know that our social care colleagues, our education colleagues, our police colleagues are all, you know, the same. All of us need more resource to be able to do what we want to do. So we've built the standards on 5 key areas of safeguarding knowledge and capabilities. So we've got professional safeguarding responsibilities, identification of abuse and neglect, responding to abuse and neglect, documenting safeguarding concerns and information, because that's a particular thing for us in general practice, particularly as medical records or GP records are often the hold all, aren't they, for medical records, and for us in England, the additional challenge is patient online access and all the kind of challenges that has brought to us in safeguarding. And then information sharing and multi-agency working in each of these 5 key areas are critical to safeguarding. And the identification of abuse and neglect and responding to abuse and neglect cover, you know, the child aspects and the adult aspects as well. And then the information sharing, we know that information sharing is probably the #1 thing that is mentioned when there are, you know, safeguarding or protection reviews, when a child or adult dies or is seriously injured because of abuse and neglect. Lack of information sharing or missed opportunities around information sharing is often cited, and that can be complex for us in health when we are balancing data protection law and the common law duty of confidentiality as well. We've got to take both of those things into account. So in terms of our levels of staff groups, this is just a bit of a snapshot of levels 1, 2 and 3. You will see that the vast majority of clinical staff are in level 3. I've just highlighted the GP trainees down at the bottom who say your requirements have not changed. And then in addition to levels 1, 2 and 3, we have 2 groups that have some additional knowledge and capabilities, and that is practice managers and practice safeguarding leads as well. So what are the new training requirements? So you may remember from before that it used to be, so you used to have to do 12 hours of child safeguarding and child protection training over 3 years and 8 hours of adult for a level 3 clinician, and we know that the number of hours that you sit doing something doesn't necessarily mean anything, does it? So we wanted to move towards what is meaningful training, what safeguarding training actually makes a difference, and how do we embed safeguarding training and learning into everyday practice. So obviously, and this is a summary, it's in much more detail on the website, so have a look and read in much more detail on there. But every level, safeguarding should be included in every induction, and I hope that that's the case already. It is for most organisations, and then annually each staff group needs a safeguarding update. We haven't specified what that update might look like. So for example, for us in North Yorkshire and York, we are developing a level 1 and 2 package that we are going to do a recorded webinar for their annual update this year, and send it out to practice safeguarding leads for them to work through with their level 1 and 2 staff, and there's some interactive case studies in that. Level 3 also require an annual safeguarding update, but in addition to that, it's demonstrating engagement in safeguarding learning and reflection across the 5 key areas of knowledge and capabilities. We've developed 2 new templates to support that, and it should also obviously cover child and adult safeguarding as well. So yeah, just in terms of the 2 specific groups that we have highlighted as needing additional knowledge and capabilities are these 2 groups. Practice managers, we know that practice managers play such an important role in everything in general practice, but particularly safeguarding. Their additional knowledge and capabilities are very much around strategic and organisational safeguarding. So things like safe recruitment, managing allegations, that kind of thing. And then GP practice safeguarding leads, again, the additional knowledge and capabilities are again centred around that more organisational strategic safeguarding within your organisation. conversation, and how to support that. And that can be how to, ensuring policies and procedures are up to date and in place. It can be working with the practice manager to make sure everyone's got their safeguarding training up to date, the inductions up to date, all of that sort of thing. How to embed, how to lead safeguarding inquiries within your practice if there's been a significant event, and how to embed the learning of that, all of that sort of thing. So alongside the standards, we have developed a whole new safeguarding toolkit and safeguarding hub. So this is where you'll find it. And I'm just going to run through the resources that we've developed to support the safeguarding standards. So we have a podcast. It's 15 minutes. It's the Honorary Secretary Michael Mulholland interviewing me on the standards and resources and how these can be implemented in general practice. So you can have a listen to that whilst you're exploring the website. Then we have a section on key questions and safeguarding. One of the things that we, when we spoke to lots of GPs some of who are more specialist in safeguarding, and others who were just, just normal GPs, about what kind of things that they really need. And there was felt to be a need for some quick access, summary information, so that if you're, at 5 o'clock on a Friday on your own, not knowing what to do, where do you go to? Obviously, it's generic information that can apply to principles that can apply across all four nations, but it gives you some idea of where you can find phone numbers, or where you can get help from, who you can ask for safeguarding advice, some summary information about, you've been asked to share information you're not sure. Question 4 gives you some summary information about that, and then links obviously to our more in-depth information sharing guidance. Question number 6 has a template in it. So what local knowledge do I need to safeguard my patients? And again, one of the things that we heard from GPs is that you need to be able to know who to speak to when you have a safeguarding concern. So it's a template for, so hopefully practice and practice safeguarding leads can fill that in. It might be able to be done over a bigger area about, who's your safeguarding lead in your practice? Who's the, is there somebody who leads on safeguarding administration? Who's a Caldecott guardian? How do you if you've got a child protection concern, who do you speak to? Where are your numbers? Where are the referral forms? Adults the same. Who's your local domestic abuse agency? How do you contact them? What do you do? Who do you speak to if there's been an allegation that a member of staff has caused harm or abused somebody? What do you do? So those kind of things, and then hopefully they can be on every wall or on every PC or wherever it is that you work. Particularly for those of you who work in out of hours settings, what do you do at 3 o'clock in the morning in a GP out of hours session if you've got a child safeguarding concern? Who can you speak to for advice? It's those kind of things, hopefully setting out beforehand, so that if you're ever in that situation and you need it, the information is readily there for you. So we have developed an extensive new safeguarding toolkit that covers child and adult safeguarding and all aspects of safeguarding in general practice. It's a one-stop shop for safeguarding in general practice and matched to the 5 key areas of the safeguarding standards. So there are 5 parts of the toolkit matched to the standards, and it can be used in lots of different ways. The toolkit is obviously there are lots of similarities of safeguarding across the 4 nations. Safeguarding is safeguarding, domestic abuse is domestic abuse, regardless of where you're at. There are obviously differences in legislation. Lots of legislation is similar across the 4 UK nations, but a lot of the toolkit it's designed to work in conjunction with your local knowledge, with your local safeguarding professionals, with for you in Scotland with Scottish Government, and complement the work that they are doing. And it sets out general principles about safeguarding, rather than you must do this or you must do that. It can be used in lots of different ways. We know that people use the toolkit either to work through for their own kind of CPD, or if you we've got a whole section on domestic abuse, where we've focused on identifying, understanding different levels of risk in domestic abuse and what you can do about those different levels of risk. GPs and general practice staff are not expected to be domestic abuse experts, but you do need to be able to identify where there might be different levels of risk. So what does life-threatening domestic abuse look like? What does high-risk domestic abuse look like? And what are your options for, what possibilities can you look at for those kind of sections, so you can use it in that way as well. So some of the key highlights of the toolkit. So identifying child and adult abuse, we've pulled together sort of information on all the different types of child and adult abuse. In responding to child and adult abuse, again, we've set out ways about thinking about how do I approach a safeguarding issue. I've got this concern about this family or this adult. I'm worried there might be some abuse happening, but how do I sort that out in my head, and how do I work through it? And it just gives you ways of kind of, and principles of working through. The template to support induction and local safeguarding knowledge we've done. We worked really closely with the Centre for Expertise on Child Sexual Abuse to develop a tool on talking about child sexual abuse and tackling professional concerns. You will probably, you may be aware of ICSA, which is the Independent Inquiry into Child Sexual Abuse, which has brought up all sorts of recommendations, and with thousands and thousands of testimonies from people who had experienced child sexual abuse, which is an incredibly powerful review. And we know that child sexual abuse is one of the things that none of us are very good at talking about or tackling, and I say that across all of healthcare, education, social care. We get really very frightened about it. We like to think about everything else other than child sexual abuse. So what we did with this document was try and tackle some of those professional concerns to build up your confidence. And the toolkit and the standards are all based around the skills that you have as a GP, or that you are developing as a GP trainee already. And the skills that you need to safeguard are the skills that you have, be that listening, professional curiosity, empathy, thinking about what life is like for that individual patient, that child, that adult. You have the skills already to do safeguarding. It doesn't require a special set of skills. We mentioned the domestic abuse section. We've got a focus on assessing mental capacity. We know that particularly in adult safeguarding, adult protection, particularly around things like self-neglect and homelessness and those kind of areas, that often professionals don't feel confident in assessing mental capacity. And I was just saying to Jamie before we came on, actually the Scottish guidance on mental capacity is excellent, and we pulled a lot of that actually into the toolkit around, is a person unwilling or unable to safeguard? How do you work through that? And because we know that people are often deemed as has capacity, but actually mental capacity hasn't been sort of properly explored or looked at. So it's trying to, again, giving you principles to look through that. We've got a focus on transitional safeguarding, which is we know that young people often face a cliff edge, don't they, when they come to 18. In safeguarding, it is no different. Child and adult safeguarding systems are very different. Legislation is different, and it's just thinking about how do we support young people where there are already safeguarding concerns through their journey from adolescence into adulthood. Because if you're being criminally exploited at 17 years and 11 months, it doesn't stop, does it, just because you've turned 18? But agencies' approach to you might stop. So it's thinking about how do we support young people. Safeguarding in the independent sector, again, there's particular opportunities and challenges with the independent sector, and again, helping that sector work through those. We've got an updated safeguarding documentation and coding resource, and there are so many safeguarding codes, as you will know. You use READ v3 codes, and you're moving towards SNOMED codes, I think. And what we have decided to do, and what we've tried to do, is pick it's about 23 codes, sets of codes, and there's the SNOMED code, there's the READ v3 code, and there is the other code which I can't remember. So there's 3 codes for each problem. And what we want to do is create a shared language of safeguarding across all of general practice, so that no matter who you are, as general practice teams become more varied and bigger, or for GP locums who work across different sites, for example, being able to log onto a record and go, oh, this child, there's a safeguarding concern in this family. Okay, I'll just have a quick look at that, and it just being instantly recognisable to everybody across general practice. So getting used to using those codes and that documentation guidance just helps that. We've got specific guidance on documenting domestic abuse as well, just because of the particular challenges around that. And we are doing a formal review of that just to see whether it needs updating. And then the fifth part is information sharing resource. Now, information sharing, as I mentioned earlier on, is really tricky, isn't it? And it's really tricky for us in health and often other agencies. What we get is often, but you don't need consent to share information. You don't need consent to share information. And what often people are talking about is data protection law. But in healthcare and as doctors, and as per the GMC guidance, so we worked really closely with the GMC and the Information Commission Officer to put this resource together to try and, it's never simple information sharing, but to try and simplify it and explain it as much as possible. And again, it's guidance around. So in health, we have to consider both common law duty of confidentiality and data protection law, and both have to be considered separately but equally. So under the common law duty of confidentiality, there are situations where you are able to share information without consent from the patient, and that tends to be those situations where there is significant risk to a child or an adult. For example, the GMC guidance, if you're not familiar with the GMC guidance of protecting children, or the not to 18 guidance, do refresh your memory on that and your mind on that, because it sets out really clearly the kind of principles that we have to go to. So hopefully the information sharing resource will support timely and appropriate information sharing. And so that we can remove some of the barriers around information sharing. This is just the front page of the talking about child sexual abuse, tackling professional concerns, and I think it's about 3 pages from what I can remember. We've got templates to support safeguarding learning and reflection. So we've got a safeguarding case review and a safeguarding reflective practice structure template. And again, the case review is just a really simple format about thinking about, if you've been involved in the case, what was your learning, what went well, what didn't go so well, what are your development needs going forward. And the safeguarding reflective practice structure template can be used for your annual appraisal, for example, and again looks at kind of what's your role in safeguarding, what are the have you done any safeguarding CPD this year, have you been involved in any cases, and that can include, there's been a colleague had a significant case in the practice and has shared learning from that. We know we learn a lot from cases, don't we? And sort of being able to document that is really helpful. We also have a new e-learning on core safeguarding in general practice. This is 3 modules. So everything on the RCGP website in terms of the toolkit, the standards, the podcast, the templates are all available to anybody. The new e-learning is free for RCGP members, and the safeguarding training days, which I'll talk about, are free for RCGP members as well. There's a small cost for those who aren't. But again, this core safeguarding in general practice would be useful for, again, GP trainees, or if you're new to general practice, if you're new to general practice in the UK, for example, and it just gives you that, again, those basic principles, following along with the GMC principles around safeguarding. And it's matched to the 5 areas of the standards. And then just to let you know, we also run virtual safeguarding training days level 3. I run those several times a year, and we change the content on a yearly basis, so that you're getting something new. So that's a quick run through. I'm going to stop sharing and hand over to Gemma. I'm coming to you first, aren't I, Gemma, for your bits.
Thanks, Joy. Sorry, just to get things up and running here. So I'll be sharing slides for myself, Jamie Aarons and Teresa. So I'm just going to start the slide now. Okay. So yeah, myself and Jamie are coming from the Adult Support and Protection Policy team in Scottish Government, and Teresa from Child Protection, as we introduced. And just to give you a quick overview about the kind of things we cover on a day-to-day basis. So we have responsibility in Adult Support and Protection for things like joint inspection programme, commissioning services to support the operational delivery of adult support and protection in Scotland. So we have a national adult support and protection coordinator who is there to offer some kind of guidance and advice to operational staff, but also to run sessions. We also cover the legislation, so making sure that national guidance is accessible, it's refreshed appropriately, and that the legislation is kept up to date, and just offering kind of general policy and guidance for the Scottish context. So I'm going to pass to Jamie, who's going to take you through some of the data that we also have responsibility for collecting in Scotland. So Jamie, if you want to talk to the next couple of slides, that'd be appreciated.
Thanks, Gemma. So the slide that's in front of you just now, I've put really to give you a sense of the scope and scale of adult support and protection activity in Scotland. So we have a quarterly national minimum data set. So we receive quarterly returns from each adult protection committee partnership area. So there are 32 of those, as you'll know, in Scotland. Inclusive in those returns are the sort of categories that you see in front of you. So the number of referrals, inquiries, case conferences, and so on, lots of process-oriented indicators. But I thought it worthwhile just to share, to show the scale, so in 23-24, nearly 63,000 adult support and protection referrals across the country. That's then broken down and just looking at ways or areas in which GPs may be involved, and I'll come on to talk about some of those referrals that may have come from yourselves, in fact, or indeed your request to you to participate in case conferences, to provide information, to contribute to inquiries and investigations. And some of you may indeed also have been involved in large-scale investigations, which are most often seen in care homes. So that's really those times at which more than one adult may be at risk of harm from the same alleged harmer. And while the majority of them historically have been in care homes, we're actually seeing an increasing number of large-scale investigations in care at home services and other support services in the community. So day centres, respite units, and indeed as well as hospital wards or community hospitals as well could see an LSI. So I thought it just important to show that scale of ASP in the country. Next slide, please, Gemma. Hasn't changed for me, might have changed for others. I've been having all sorts of tech problems. I'll speak to the next one. Can anyone else see it changed?
No, it's my mouse is playing up with me. There we go.
Oh, that's fine. I assumed it was me. I've already had to come out and rejoin twice. Scottish government laptops are not a huge fan of Zoom, which my laptop decided to exemplify. This slide here, I think, again, interface between adult support and protection and yourselves as GPs will come as no surprise. I don't think that the highest primary client group for inquiries with investigation, so where they've gone a little bit deeper into an investigation of that referral, highest primary client group are those with mental health problems. That box has been ticked. And where there have not been kind of deeper dives into investigations, the highest primary client group are those with dementia. And just that bottom bullet point there to flag, we don't break down primary care as source. We don't have any more granular information than that. So in this context, primary care includes yourselves as GPs, but will also include dentists, pharmacists, optometrists, and district nurses. But you can see the scale of your contributions as 3% from 23-24. So those are where the ASP referral has come directly from a primary care source. So certainly not insignificant. And I would like to think as we're raising awareness and primary care colleagues are becoming even more aware of the role of adult support and protection and its relevance, that proportion of referrals coming from primary care may increase. I'll hand back to you, Gemma.
Thanks, Jamie. So as Joy had already referenced, there is national adult support protection guidance specifically for general practice that was published in 2022. And this is just the kind of first page that you land on when you come into the guidance, which I think like Joy's speaking about as well as like where can you get that quick, this is how it might go, that what do I need to know, what do I need to think about when you've come across an adult who you think could be at risk of harm. The guidance and the link, you can use that link there, but I'm going to come on to some other resources that we've been developing as well. So this is to talk about the 7-minute briefing that we have been developing and launched alongside the Safeguarding Toolkit. So the reason we've taken this approach is because it works quite simply, and we've used it in for healthcare staff, we've used it in financial institutions. So where there is a number of different guidance and policies, procedures that you may have to follow when you're thinking about which adults could be at risk of harm and what you should do with that information, and what your roles and responsibilities are. It's such there's such a number of different places that you could be looking for it, so this puts it all in one place. We've also created this 7-minute briefing with child protection, so working alongside really closely to align adult support and protection with child protection and those roles and responsibilities that are shared. That's the kind of what we're hoping to do with this. It should hopefully take you under even 7 minutes to read, so it's quick. It's something you could print and have up, or you could have shared, kind of linked to your laptop to easily access. And if you prefer, we also have placed this on Adult Support and Protection Information Hub, where you'll find all information and resources that either are about national guidance, there's some local guidance in there specific to certain areas, there's tools, so there's a link in there as well to the hub that our partners IRIS that we commission. IRIS are a social work research organisation, and they have been supporting us to develop a lot of these tools. So this has been done in conjunction with our National Adult Support and Protection Coordinator as well. So hopefully you'll find that resource useful, and we can, it is within the Safeguarding Toolkit resources that were disseminated, but if you need a link to that, we can share that in the chat. One of the main pages that I'll come on to, and I think Joy's already touched on this, is information sharing, so I'm just going to pass back to Jamie, who can speak to this probably more from her social work perspective. Thanks, Jamie.
Thanks, Gemma. Yeah, I mean, I think as Joy reflected on, and as the Safeguarding Toolkit rightly has a whole part 5 around information sharing and multi-agency working, we thought it valuable, again, given that the RCGP work is on that 4 nations basis, just to hone in for Scotland specifically, and indeed the 7-minute brief that Gemma just spoke about. There are blurbs, minutes, as it were, of that 7-minute brief that are specific about information sharing. So again, it's just thinking about, what information is proportionate to share, what's relevant to share about those specific concerns. And grateful to Joy for highlighting the relevance of the Adult Support and Protection General Practice Guidance, which does have a whole section as well on information sharing and draws upon GMC guidelines. And we also worked quite closely with the Information Commissioner's Office and indeed the Caldecott Guardian as well, to really make clear where making referrals under adult support and protection is permissed as well as encouraged. And that being separate from as well cooperating with, as I mentioned earlier, those inquiries, that investigative activity, perhaps contributions to case conferences. Again, thinking about the principles around sharing of personal information for the purposes of safeguarding. And I suppose also bearing in mind the criteria for adult support and protection, one of which is that the adult is not able to safeguard themselves, which is, although complicated, different, as you know, to capacity. So being very mindful that an adult may indeed have capacity to make certain decisions while still being unable to safeguard themselves, as well as meeting the other 2 criteria for an ASP referral to be warranted. So just some signposting there for yourselves as well. Thanks, Gemma.
Yeah, so just to finish our section before I pass over to Teresa, speaking to child protection. This is what the 7-minute briefing looks like. So it has all the links, takes you through from kind of why does it matter to where you can get those tools, and the different the Scotland specific guidance and requirements for thinking about adults who may be at risk of harm. So as I say, that can be popped in the chat there if you want to find that on the hub, if you don't have that already. And I'll pass over to you, Teresa, now, and I'll continue to share your slides if that's helpful, Teresa.
That'd be great. Thank you. Hi, everyone. Like I said, I'm from the child protection team, and we try and work as close as we possibly can with adult support and protection just to line things up as well as we can. So our main kind of piece of guidance in Scotland, as you probably know, is the National Guidance for Child Protection, most recently updated in 2023. Gemma, if you could just pass on to the next slide. So that guidance describes the responsibilities and expectations of everyone working with children in Scotland, how professionals and agencies should work together with parents, families, and children to protect them from abuse and neglect. So child protection obviously involves a range of activity and specific professionals will have kind of different or engage differently with different elements of this, or have different roles and responsibilities. The requirement to prevent significant harm to a child for professionals often takes the form of an interagency referral discussion, which can be called together by the relevant agencies, so health, police, and social work, and they'll all come together to assess the level of risk to a child and decide next steps. Child protection activity also requires, ongoing assessment, which includes taking into account the needs and experiences of the child. And I think really importantly, all CP activity really requires constant collaboration and information sharing between agencies and efforts to work together in partnership as much as possible. I think learning reviews into specific cases really underline the importance of that collaboration and sharing of information time and time again. So on the next slide, Gemma, if you could move, thank you. If you move to that, this one shows the child's journey through time within the context of, I suppose, protective factors up top, as well as the potential responses to risks or harm that children may face along the bottom. So in terms of protective factors, the underpinning approach in Scotland, you'll be aware, is GERFEC. Also of relevance is the promise, and you also have the named person fulfilling a really important role in all of this. So that will most often be the health visitor in the early years, and then the teacher, head teacher later on. You can see that when the child is at risk of or experiences harm, there might be a variety of CP or CP related responses, like interagency referral discussions or other types of kind of CP meetings. Berenshus is of course really critical. Care and risk management processes if children pose a risk to themselves, and then guardianship also plays a role there for unaccompanied asylum-seeking children specifically. If you could move to the next slide, Gemma. I've set out again a bit of data for context, similarly to ASP. I thought just a little bit of data would be helpful to show, I suppose, the range of CP activity across the country. So from 2023 to 24, we have almost 18,000 children being discussed at interagency referral discussions. And of course, the response will be different in each case. And you have a snapshot from last summer showing a bit over 2,000 children on the child ending up on the child protection register at that particular point. And of course, children are always coming on and off the register, which you can see by the numbers there being registered and leaving the register. Interestingly, main concerns identified about children, those have been studied for a couple of years, those kind of proportions. They're domestic abuse, neglect, parental substance use, parental mental ill health, and emotional abuse. And I think in that list, it's worth noting how relevant concerns about the parent are to child protection. Next slide, please. I know I've hinted at it before, but I've provided here what the National Child Protection Guidance says about the role of GP and practice, specifically about being, really well placed to identify concerns about children. I think what's really important here for primary care is, the referral of any concern without delay to police or social work, and then to share information which contributes to building up a picture about the child in an investigation or kind of for a risk assessment or an interagency referral discussion. So that primary care information can be really crucial, of course. And I would also note the point made here in the second paragraph about primary care, of course, being really well placed to also identify risk factors for adults who are parents or carers, which may then have the potential impact in terms of their ability to care for children, so then could have potential child protection consequences. And next slide, please. And lastly, just like ASP, here we've got the kind of CP equivalent 7-minute briefing. It's kind of set up in a very similar way to align as closely as possible, and covers the key points here, like expectations around information sharing, primary care's role in identifying and responding to CP concerns, about taking part in child protection investigations, and so on and so forth. So like Gemma said, that's been disseminated, but please let us know if you need help getting your hands on it. I think that's it for me. Thank you.
Thank you very much, Teresa, Gemma and Jamie. I don't know if anybody has any questions. Just while you are thinking about whether you've got any questions or not, I'm just going to show you on the toolkit where some of these things are that we've just been talking about. So this is the safeguarding hub when you go onto it. So if you go into the toolkit, and then go down table of contents on the side, go down to safeguarding across the 4 UK nations, scroll down to Scotland, where you've got the legislation guidance, and we have both 7-minute briefings down here as well. So that's where you will find those. Just building on something Teresa then said, just to give you an example of what's in the toolkit, Teresa, you were talking about the importance of a big part of our role of GPs in terms of information we provide, particularly around child protection, is around the adults, absolutely, as you've said. So when we have, if you go down to part 3, which is responding to abuse and neglect, and go to making a child safeguarding referral, what we have on here is sort of top tips for making a child safeguarding referral. And this is sort of the kind of information, what information do we hold in general practice that's really useful? So we have the kind of 5 C's. So we've got clarity, and then we've got information about the child, and that lots of things about are they homeschooled? Is there any issues with school attendance? No one health issues, no one disabilities. Medication, is that being requested and taken appropriately? Vaccinations, reviews and things. Concerns we've got, and then context. And in the section on context, we've got some suggestions of what relevant information about parents and carers might include. So that's things like significant mental health issues, any disabilities, medication that they're on, consider any addictive medication that parents are on that would impact their ability to safely parent their child, alcohol or drug misuse, what's their engagement like with general practice, what's their health, if they're or if appointments being frequently cancelled, what's their experience of, do they have their own experience of abuse and trauma as a child or as an adult, and think about how does that impact so any previous or safeguarding concerns. Think about the dynamics. Is this a family that is going through a really difficult breakup at the moment? Is there conflict between parents? What's the impact of that on the child? You may not have that information, but it's useful information if you do have it. What are their vulnerabilities? Think about poverty, think about racism, think about their housing status, their socioeconomic factors. How is that all adding? So we set out, and then obviously one of the most important things is what their strengths. We always sort of talk about that, and we have a similar sort of thing in the adult as well. So that's just to give you a to tie in with what Teresa's been saying. It just because what we know is sometimes it's difficult to know what information is relevant and what is important. So we've tried to help with that in the toolkit by thinking this is information that we might help. And sometimes we know very little about a family, and that's fine. If you don't know much about them, you don't know much about them. But it's sometimes knowing about what is the information that's important to that multi-agency arena. The other thing, just to before I forget, is that you may or may not know that the RCGP have lots of different special interest groups, and we don't have one for safeguarding, but we are just setting one up for safeguarding. So if that is of interest to you to join a community of practice, you do not have to be a safeguarding specialist, or if it's just something you're interested in, or if you're a GP trainee, it's open to GP trainees as well. If you're thinking, do you know what, safeguarding is something I'd like to know a bit more about, maybe develop some expertise in the area, please come and join us. And I'm just going to pop that in the chat so you can have a look at that webpage if you want more information about that. Does anybody have any? There's no questions in the chat unless I'm just not seeing. Does anybody have any questions or comments? You can do hands up, I think, as well, if you want to speak. If there's anything anybody wanted to ask. If not, you can absolutely use today as part of your safeguarding trip. Your presence here today is absolutely part of your safeguarding learning and reflection and training. And we've covered a lot of the RCGP standards on your professional responsibilities, and that has been outlined by the Scottish Government team as well about how that works in Scotland. So you absolutely can use the reflective template to talk about today, and then it's the next steps. It's what you're going to do next. So you've been here today, you've had a listen. What's your next steps? What's your practice going to change? And it might just be, do you know what, I'm going to read those. If there's only one thing you do from today, go and read both of those 7-minute briefings. They're excellent, and I've sent them to the equivalent colleagues in the other 3 nations, going, this is brilliant. Do you want to kind of copy this for your own kind of nation? So if it's one thing that you do from today, go and have a read of those 7-minute briefings. They're really good, and I'd highly recommend reading them. Anything else from you, Gemma, Teresa, Jamie? Yes, we have recorded it. So yes, you will be. Those who had registered for today will get the recording of that. Do share in terms of sharing the toolkit, and do go back to your colleagues and highlight the toolkit and the standards as well. Back to you then, Kirsty, I think.
Yeah, perfect. Thank you all so much for joining us this afternoon, and thank you to all of our speakers today. I don't see any questions coming in or any hands up, but if we do get any questions, I can, feel free to email me directly and I can sort of signpost those on. So that's no problem at all. And if you would like access to the recording, I'll send a short feedback survey after this, and I'll pop a tick box on there, so if you do want access to the recording, I can share that with you as well. So yeah, thank you all very much for your time this afternoon.
Somebody's just asking about a certificate of participation. Now, I know that we've moved very much away from certification, but we know that GP trainees have to have that. Is that something that can
yeah, I can do that as well.
Kirsty?
Yeah, if anyone does need certificates for, and we don't normally personalize them, but if you do need your name on them, that's absolutely fine. And again, we normally have just the hours of the course, so the event, so this will be sort of reflective of 1 hour. So yeah, I can easily share that with anyone that needs as well. That's no problem. Oh, there's a few questions here.
Online access in England. Online access, how long have you got? Patient online access is, I think it's probably coming to you. I think it's coming to Wales, probably is probably the next nation it's really challenging from a safeguarding perspective, and I'm just gonna talk about it from a safeguarding perspective. There were obviously, if you look at patient online access as a whole, there are obviously lots of benefits to that, and people being involved with their healthcare, being able to request their medications, all of that kind of thing. in terms of the safeguarding stuff, it is so you'll notice from the our toolkit, this, you know, it is completely reliant on individual frontline practitioners to make things not visible on the online record. So you have to remember every time to make something not visible to the patient online record, and we advise that all safeguarding information is made not visible on the patient online record. We're currently working with NHS England. I'm part of the team working with NHS England at the minute to develop a national standard for proxy access, because that's our next kind of challenge about proxy access, and how do we keep victims of domestic abuse safe? How do we make sure that the that health information, you know, we know that perpetrators of domestic abuse, we know that those who cause harm to others through exploitation, domestic abuse, whatever it is, use anything at their disposal for more control, more coercion, and health records can come onto that. We have there's a whole patient online toolkit that was developed with the GPIT committee, of which I know there are several Scottish members on that, to develop that. We've had several instances where information hasn't been made visible to online access, so perpetrators have seen information. We've had domestic abuse information go out that shouldn't have gone out. It's really difficult. It is really tricky to manage. We have tried to put in as much mitigation as possible. There's a real drive for digital services, as you will know, and there's a real drive to digitalise healthcare, and there's lots of positives that go along with that. But I think from a safeguarding perspective, and all the work that we've done for the online toolkit and around documentation is around how do we keep it safe. And so one of the sort of biggest areas of contention for us is whether you should document anything in an alleged perpetrator's record of domestic abuse, for example. So if you are aware there's a domestic abuse situation, do you put something in the perpetrator's record or not? What we currently advise is no, unless you are sure that the perpetrator is aware of those allegations or that they're aware of an investigation, because the risk potentially to victims, if perpetrator becomes aware that they have disclosed information, for example, could be really serious for victims. So it's all about balancing that. There's been a lot of learning. I think the other thing about GPIT systems are not set up for things like this, so we have no safe area within GP systems that we can just automatically put stuff in. It's not seen by anybody. So I don't know if it's coming to Scotland. I suspect it probably is at some point. Yes, I can see you nodding, Shan. If that would, in terms of learning from that, if that would be something that'd be helpful in the future, I'm happy to come with my colleagues and I to come and share some of that learning. We've had a lot of learning. So do reach out through RCGP Scotland to me or to me directly if that's something that would be helpful. If anything we can do to make the process smoother for you, happy to, because it's really difficult. I think that's about it.
Yeah, I think there's one last. Oh, that was just
Jamie, you were saying that
yeah.
in some cases financial harm when alleged perpetrator is a legal proxy, which needs to be considered in recording as well. Absolutely, it's and I sometimes think it's easier to get access to someone's health information than it is to get to your bank information. Sometimes the amount of things that banks put in place, so it's trying to balance that all out is tricky, and the complexity for us in general practice is we do not always know when there's a domestic abuse situation, or someone can have online access and they be not in a relationship 1 week and then 6 months later are in a very abusive, coercive relationship, and online access is no longer safe for them, and we have no way of knowing that, unless we're told or unless something comes up. So it's trying to be sort of aware of that all the time and getting into the habit of marking things not for online access, which is a huge mindset. And I think the other thing for online access is, normally, and certainly when we write our medical notes for us, don't we, or for our colleagues, writing them with the mind that patients will read everything that you've written is tricky, but not just from a safeguarding point of view. That's, you know, just in terms of how we write stuff in records isn't always clear, is it? Or it might be clear to our medical colleagues, but not to somebody else. So it's a whole different mindset, which we're all trying to get used to. I guess it's a brave new world. Patient online access. So thank you very much, everybody. I realise it's after 2 o'clock, so thank you for having us, and hopefully we'll, you know, if you're at the RCGP conference it's in Wales this year, isn't it? So it's quite far south for you, but if any of you are coming, I'll be there running a safeguarding session on safeguarding in affluence. And safeguarding families where there's professionals involved, and doctors, lawyers, judges. We know that is a really tricky area. So yeah, we'll be trying to tackle some of that in October.
Perfect. Thank you so much for joining us, and thank you again for taking the time to talk to us today. It's much appreciated.
Thank you. Bye.
Okay, thank you.
Thank
Bye.
you.
Bye.